Good morning, everyone. I'm happy to be joined today by Minister LeBlanc, as well as by Dr. Tam and Dr. New. La campagne de vaccination de masse se poursuit. Chaque jour, on travaille sans relâche pour avoir le plus de doses possible, le plus rapidement possible. Vendredi passé, on a annoncé que des millions de doses du vaccin de Pfizer vont arriver plus tôt que prévu, dont 1,5 million de doses avant la fin mars. Suite à cette nouvelle, on augmente donc notre total de vaccins reçus contre la COVID-19 avant la fin mars à 8 millions de doses. Je sais que ça fait beaucoup de chiffres et de calculs. L'important, c'est ceci. La vaccination s'accélère de façon significative. Il y a de plus en plus de gens qui reçoivent leur vaccin, incluant beaucoup de parents et de grands-parents que vous avez hâte de revoir. Et les travailleurs de première ligne. Et chaque jour, il y a de plus en plus de gens qui sont protégés. Right now, across the country, we're getting vaccines to Canadians. We now have 4 vaccines approved by independent regulators in Canada, more than any other country. Again, you can count on the fact that any vaccine approved in Canada is both safe and effective. Last week, we received almost 1 million doses of COVID-19 vaccines. This week, we're getting another 1 million. And before the end of this month, we will have received a total of 8 million doses of COVID-19 vaccines. On the 500,000 AstraZeneca vaccine doses delivered from the Serum Institute last week, these shots are being distributed to provinces as we speak. More and more people are getting vaccinated every day. That means more grandparents, healthcare workers, and vulnerable people are now safer. Our top priority is to get you your shot as soon as possible. No one will be left behind. Just take Myrtle from Kanawake, Quebec. She's 90 years old and was the first elderly person living at home in Kanawake to receive a vaccine. For Myrtle and her family, getting her shot was a big moment because now she'll be able to tell her sons who call every Sunday that she is safer. La dernière année n'a pas été facile, mais malgré tout, c'est important de se rappeler qu'on a des raisons de rester positifs. Par exemple, hier, c'était la Journée internationale des femmes. C'était le moment de s'arrêter pour célébrer les réalisations des femmes dans toute leur diversité, ici au Canada et ailleurs dans le monde. Malheureusement, c'était aussi le moment de se rappeler que les conséquences de la pandémie ont été plus prononcées pour les femmes et les filles. On ne peut pas laisser cette crise faire reculer tous les progrès sociaux et économiques acquis par les femmes depuis tant d'années. Pour rebâtir en mieux, il faut que la relance économique puisse profiter à tout le monde. Yesterday, Deputy Prime Minister Freeland announced the creation of the Task Force on Women in the Economy. This 18-member task force, from CEOs and childcare advocates to labor representatives, economists, and Indigenous leaders, will advise the government on continuing to advance gender equality in the wake of the pandemic. We need to rebuild an economy that's fair for everyone. So that's exactly what we're going to do. Of course, this is just one part of the equation. After all, it's almost impossible to get, let alone keep, a good job without a roof over your head. Everyone deserves a safe and affordable place to call home. Yesterday, the federal government partnered with the government of British Columbia to announce a $517 million housing benefit investment over 10 years. This is part of our $2 billion commitment to the Canada Housing Benefit to support families right across the country. For more than 25,000 households in BC, the new Canada-British Columbia Housing Benefit will provide financial assistance to marginalized people with low incomes to help with monthly rent. On average, this could mean around $400 in support each month in rent. This program is designed to get right to people who need it most. That's why the benefit will go directly to households through nonprofit housing providers through BC Housing. Investments like this are real steps forward to make sure that everyone has a safe place to call home. I want to thank Ministers Ahmed Hussein and Joyce Murray, Member of Parliament Terry Beach, and their counterparts in BC for all their important work on this issue. Jeudi cette semaine, le 11 mars,
On Thursday
ça
this
va
week,
faire
the
un
11th
an
of March,
que la COVID-19 a
it will
été
be 1 year since
officiellement
COVID-19
déclarée
was officially
une
declared
pandémie
a global
mondiale
pandemic
par
by
l'OMS.
the WHO.
En peu de temps, nos
In a
vies ont
short
changé.
time, our lives
Ce
have
qui
changed.
paraissait normal la
What
veille
seemed normal
allait
the
le
day
devenir
before
de moins
was
en
going
moins
to become
au
less and
cours
less
des
normal
semaines et
in the
des mois
weeks
qui
and
allaient
months
suivre.
that followed.
Cette semaine,
This week,
on marque un mois que vous faites des sacrifices.
you have been making
À tous les
sacrifices
Canadiens qui
for
font
a
des
year.
efforts
To all
petits
Canadians
et grands,
who make efforts
je veux
big
vous
and small,
dire merci.
I would like to say thank you.
Je sais que c'est pas
I know
facile.
it's not easy.
C'est le genre de crise qui arrive
It's the
seulement
kind of
une fois
crisis
par
that
siècle.
happens only
On va
once
s'en
in a century.
sortir en étant
We will
unis
get
et en
through it by
continuant
being
de
united
travailler
and by
ensemble.
continuing to work
On fait
together.
du chemin depuis l'année
We've come a long
dernière.
way since last year,
Il en
and
reste
there is
beaucoup
still
à
a
faire.
long way to
On
go.
va finir par
But
vaincre
we're going
la
to end up
COVID-19.
defeating COVID-19.
We're naming March 11th, 2021 as a National Day of Observance to honor everyone we lost to this terrible virus and to recognize the impact this global pandemic has had on all our lives. Around the world, more than 2.5 million people have died because of COVID-19. 22,000 of them were our fellow Canadians. They have been taken from us, but they will not be forgotten. Each one was special. Each one was loved. They were grandparents, friends, parents, brothers, sisters, and colleagues. There are no words for the pain of losing someone you love. As a country, we remember all those we lost and we mourn with families and friends. To everyone who is grieving, we're thinking of you and we're there for you. On Thursday, I invite all Canadians to join together to honor the memory of those we have lost and to thank all those who continue to make incredible sacrifices to fight this pandemic. Together, we will beat this virus. Merci. Je cède maintenant la parole à la
I
Dr.
now
Tam
give
et
the
le
floor
Dr.
to
New.
Dr. Tam and Dr. New.
Bonjour à toutes et à tous. This week
Good morning.
marks the 1-year anniversary of the World Health Organization's declaration of the COVID-19 global pandemic. As we update the latest numbers, let's not forget that the impacts have gone far beyond the numbers. During this long and difficult journey, we are continuing on together. To date, there have been 890,698 cases of COVID-19 in Canada, including 22,276 deaths. There are now over 30,300 active cases across the country. Over the past week, an average of over 2,900 new cases and 37 deaths were reported daily. During the same time period, over 2,080 people with COVID-19 were being treated in our hospitals each day, including almost 550 in critical care. This weekend, as I reflected on the week ahead, I felt a mix of emotions that I'm sure most of us are feeling in one form or another. First, in looking back at the year behind us, it is a time of solemn remembrance of the cherished lives we have lost. At the same time, it is clear that our work is not done. To honor the memories of those we have lost and appreciate the progress that our sacrifice has afforded us, it is time to pause to remember, gather our strength, and commit to our future by sustaining our efforts until the crisis phase of the COVID-19 pandemic is behind us. In remembrance, the Government of Canada has designated this Thursday, March the 11th, 2021, as a National Day of Observance to commemorate those who lost their lives and the significant impacts we have all endured because of COVID-19. As we reflect, it is also a time for great hope, given many important advancements. Not only have we all learned about the public health measures and individual precautions that work to reduce the spread of rapidly spreading respiratory diseases like COVID-19, but our efforts have held the force of infection at bay long enough to buy time for research on vaccines and treatments. It would be very easy to take for granted the incredible worldwide and population-wide effort that has brought us not one, but multiple safe and effective COVID-19 vaccines. In fact, the timeliness, safety, and effectiveness of these vaccines was not a given. And I would say it has in many ways exceeded the hopes we dared to have a year ago. We have all experienced loss, and I know we're all tired. But let's also recognize some of our achievements and the good things that we want to carry forward. We can have renewed faith in ourselves coming together during a crisis, sticking it out longer than any of us might have guessed we could do, and doing it with enduring kindness. Though there have been stumbles, we have adapted and we have endured, and I know we have what it takes to see things through. Lest I leave you without a public health reminder, as we continue to accelerate vaccinations, having the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible, and wearing the best fitting mask will continue to serve us well. Thank you.
Bonjour à toutes et à tous. Cela fait un an cette semaine que la pandémie de COVID-19 a été déclarée par l'Organisation mondiale de la santé. Alors que nous mettons à jour les derniers chiffres, n'oublions pas que les répercussions vont bien au-delà des chiffres dans ce long et difficile parcours que nous faisons ensemble. À ce jour, il y a eu 890 698 cas de COVID-19 au Canada, dont 22 276 décès. Il y a maintenant plus de 30 300 cas actifs au pays. Au cours de la dernière semaine, 2 900 nouveaux cas et 37 décès ont été signalés en moyenne chaque jour. Pendant la même période, plus de 2080 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont presque 550 aux soins intensifs. Cette fin de semaine, en réfléchissant à la semaine à venir, nous avons éprouvé toute une gamme d'émotions que nous en sommes sûrs la plupart d'entre nous ressentent sous une forme ou une autre. Tout d'abord, en pensant à l'année qui vient de s'écouler, nous devons rendre un hommage solennel à toutes les personnes qui nous étaient chères et que nous avons perdues. En même temps, il est clair que notre travail n'est pas terminé. Pour honorer la mémoire de ceux et celles que nous avons perdus et constater le progrès que nos sacrifices nous ont permis de réaliser, il est temps de s'arrêter un moment pour nous souvenir, rassembler nos forces et nous mobiliser pour notre avenir. En ne relâchant pas nos efforts tant que la phase critique de la pandémie de COVID-19 n'est pas traversée. Le gouvernement du Canada est désigné ce jeudi 11 mars 2021 une journée nationale de commémoration pour que nous nous souvenions de ceux et celles qui ont perdu la vie et des conséquences importantes que nous avons subies en raison de la COVID-19. Ce moment de réflexion est aussi un moment où de grandes et nombreuses avancées nous donnent un immense espoir. Non seulement nous en savons tous plus sur les mesures de santé publique et les précautions individuelles à prendre pour réduire la propagation rapide des maladies respiratoires telles que la COVID-19, mais nos efforts ont permis de contrôler l'infection suffisamment longtemps pour que la recherche sur les vaccins et les traitements puisse se faire. Il serait très facile de considérer comme allant de soi l'incroyable mobilisation de la communauté internationale et de la population de chaque pays, grâce à laquelle nous avons pu avoir non pas un, mais plusieurs vaccins sûrs et efficaces contre la COVID-19. En fait, la rapidité avec laquelle ils ont mis au point leur innocuité et leur efficacité n'était pas acquise d'avance. Et nous dirions qu'à bien des égards, jamais nous n'aurions espéré de telles avancées il y a un an. Nous avons tous subi des pertes et je sais que nous sommes tous fatigués, mais sachons aussi reconnaître certaines de nos réalisations et soyons conscients des éléments positifs que nous voulons faire avancer. Nous pouvons avoir une foi renouvelée en notre capacité à nous unir pendant une crise, à tenir plus longtemps que chacun d'entre nous aurait pu le penser et à le faire avec une bonté qui ne s'est jamais démentie. Malgré les faux pas, nous nous sommes adaptés, nous avons résisté, nous savons que nous avons ce qu'il faut pour aller jusqu'au bout. Nous ne voudrions pas conclure sans faire un rappel de santé publique. Alors que nous continuons de procéder rapidement à la vaccination, les mêmes mesures continueront de nous être bénéfiques. Avoir le moins d'interactions possible avec le moins grand nombre de personnes possible, le moins longtemps possible et à la plus grande distance possible, et porter le masque le mieux adapté. Merci.
Thank you, Dr. New. We'll now turn it over to questions for the media. We'll start on the phone and then come back to the room. Just as a reminder, the Prime Minister will be here for a number of questions, and then the doctors and Minister LeBlanc will be available as well. Operator?
Thank you. Merci. Première question, Raymond Filion, TVA. À vous.
Merci. Bonjour, Monsieur le Premier ministre. Vous avez toujours défendu avec vigueur le multiculturalisme et la diversité. Alors, j'aimerais savoir comment vous réagissez aux allégations de racisme au sein de la famille royale.
Je
pense que nous avions tous démontré au Canada qu'il n'y a aucune tolérance pour le racisme ou la discrimination systémique. Et moi et mon gouvernement, nous avons reconnu l'existence du racisme systémique. Nous avons pris des mesures significatives pour lutter contre ce racisme dans toutes nos institutions, dans tous nos systèmes. Je ne vais pas commenter la situation de la famille royale britannique, mais certainement que nous allons continuer notre lutte ici au Canada contre le racisme systémique. We have been very clear as a government that we will always stand up against systemic racism and intolerance in all its forms. I have recognized, our government has recognized systemic discrimination and has moved forward significantly to fight against it as it exists in all our institutions and all our systems. We need to be vigilant, and we will continue that work. I won't comment on what's going on over in the UK, but I will continue to endeavor to fight against racism and intolerance every single day in Canada.
Qu'est-ce que vous dites aux nombreuses personnes ici au Canada pour qui le temps est venu de repenser les liens entre le Canada et la monarchie, surtout à la lumière de ces allégations de racisme systémique?
Ma priorité ces jours-ci, évidemment, c'est la lutte contre la COVID-19. C'est de rebâtir notre économie en mieux. Et tous nos efforts en tant que gouvernement sont alignés là-dessus et sur l'arrivée de vaccins le plus rapidement possible. Des grandes conversations constitutionnelles, il y en a qui peuvent les avoir, mais pour moi, la priorité absolue, c'est la santé, la sécurité des Canadiens et de passer à travers cette pandémie. Right now, my single most important priority is getting through this pandemic and rebuilding the economy. Everything we're doing every single day in terms of keeping Canadians safe, of getting vaccines here as quickly as possible and into as many Canadians' arms as we possibly can is our singular focus, along with preparing the economy to come roaring back as quickly as possible. I can understand some people are looking for constitutional conversations. I'm not going to engage in those right now. I am focused on getting us through this pandemic.
Merci. Prochaine question, operator.
Thank you. Merci. Next question, Cormac McSweeney, City News. Line open.
Prime Minister, there are reports that the government will not be presenting a budget in March, that it will be later this spring. Can you confirm whether or not we will get a budget by the end of the month? And what is your government's justification for not presenting a fiscal plan this month, given the fact that we haven't had a budget since 2019?
We will be announcing the date of the upcoming budget in due course, but I can tell you that we are focused very much on getting us through this global pandemic that has been the challenge that we've faced for a full year now. We have put forward measures repeatedly, including fiscal updates and significant investments in Canadians, from families to workers to small businesses, and we will continue to do absolutely everything necessary to get us through this pandemic as long as it takes. That's the promise I made to Canadians, that we would have people's backs every step of the way, whether it's on income supports, whether it's on the housing benefits we've announced today, whether it's on getting them vaccinated as quickly as possible. We are working on the budget. It will be coming soon, but we will have an announcement to make in due course.
Follow-up, Cormac?
The military has announced that we have a new Vice Chief of Defense Staff, Frances Allen, Lieutenant General Frances Allen, the first woman to hold that role. How important is it to have a woman in that role at this particular moment in time, given the misconduct allegations against people in the senior ranks of the military? And will the government set up an independent body to investigate accusations of sexual misconduct, racism, and discrimination?
I think from day one, this government has been very clear that appointing women to positions of leadership throughout the government, starting with a cabinet that is gender parity for the first time in Canada's history, to appointments throughout our government that demonstrate how important it is to get to gender parity. I am very pleased to see a strong woman in the vice chief position for the first time in Canada's history, and obviously the tasks of everyone in senior leadership in our military is to move forward on ending the challenges of harassment and discrimination in the military and in other systems, as well as ensuring that anyone who comes forward to share stories or allegations is given the support and resources that they need. D'abord, en tant que gouvernement, on a toujours démontré l'importance de mettre des femmes dans les positions de pouvoir. Ça a commencé avec notre cabinet paritaire, mais aussi dans nos nominations à travers les instances gouvernementaux depuis 5 ans. On a vu énormément de femmes, de personnes racisées, de minorités qui ont été élevées parce que cette diversité est essentielle pour le bon fonctionnement de notre pays. Par rapport aux forces armées, je m'attends à ce que tous les dirigeants, tous les hauts cadres soient là pour lutter contre l'intimidation, le harcèlement et les agressions, mais effectivement, avoir une première femme dans la position de cette position va être important pour continuer notre lutte pour éliminer la discrimination et l'intimidation au sein de nos forces armées et de s'assurer qu'on a les ressources nécessaires pour offrir l'appui à tous ceux qui s'avanceraient avec des préoccupations
who have concerns.
Merci. Prochaine question. Reporter.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse, à vous.
Bonjour, M. Trudeau. Le Bloc québécois vous demande d'appliquer la quarantaine à l'hôtel obligatoire pour tous, incluant les voyageurs terrestres.
Including people who arrive by land, because some people cheat. They fly to Burlington, for example, and then they simply just take a taxi or a bus across the border. What do you have to say to the Bloc?
Nous avons, depuis un an maintenant, presque amené parmi les mesures les plus strictes pour les voyageurs internationaux au Canada, comparé à tous nos pays homologues. On a 2 semaines de quarantaine depuis le tout début. On n'accepte pas que les voyageurs qui ne sont pas essentiels ou résidents au Canada puissent venir au Canada, et ce depuis un an. Il y a plusieurs mois maintenant, on a instauré des mesures par rapport au dépistage avant de pouvoir revenir au Canada et maintenant du dépistage sur le retour. On est en train de regarder l'efficacité de toutes nos différentes mesures. Effectivement, il y a différentes mesures pour les aéroports versus nos postes de frontières terrestres, mais nous sommes confiants que nos décisions basées sur les meilleures pratiques basées sur la recommandation des experts sont les bonnes pour garder les Canadiens en sécurité.
Clairement, oui, un suivi clairement.
Yes, a follow-up question.
Oui, non, et pourquoi oui ou pourquoi non?
Would you say yes or no?
Je pense que c'est important de souligner que des mesures qu'on met en place doivent être les bonnes et par rapport à la sécurité, la santé des gens, mais aussi des mesures qui sont praticables, sont des choses qu'on peut arriver à opérationnaliser. Nous sommes toujours ouverts à des suggestions d'en faire plus, et on va regarder les suggestions du Bloc.
Minister, it's the first time we've had a chance to ask you about the news we reported a couple of days ago that someone who wanted to provide some information about Admiral MacDonald was threatened. And so I'd like to hear you comment on that. And then following on that is what steps have you or the government taken to give comfort and surety to those who may have some information about some of these investigations and are nervous about coming forward? Can you speak to that?
Thank you, David. It is absolutely unacceptable that anyone who would come forward to share allegations or preoccupations around incidents of harassment or assault in our military or anywhere else be faced with intimidation themselves or threats. That is something that I condemn in the strongest terms. Everyone needs to feel comfortable in being able to come forward with concerns or allegations, and there need to be the resources and supports there to make sure they are heard and that those allegations are followed up on, respecting the wish of those people who come forward. It is extremely important that anyone who works anywhere in Canada, particularly for government, particularly anyone who's chosen to serve in our armed forces, be supported and listened to. We will continue to move forward on measures to ensure that we are not only giving those supports to people who come forward, but also ensuring that we're putting in place independent mechanisms to put an end to these troubling allegations and this behavior once and for all. C'est absolument inacceptable que quiconque viendra avec des allégations ou des histoires préoccupantes d'harcèlement ou d'agression au sein de nos forces armées soit elle-même victime d'intimidation ou d'harcèlement ou de menaces. Personne qui partage ces allégations devrait subir ça. Et je condamne ces rapports dans les plus stricts termes. Nous devons d'assurer que quiconque veut venir de l'avant est écouté, est appuyé avec les ressources et le soutien nécessaires et qu'on puisse avancer avec des enquêtes indépendantes, dépendamment de la volonté de la personne qui partage ces allégations. Le respect des survivants doit être au cœur de tout ce que nous faisons. Et évidemment, nous allons avancer avec des mesures et pour offrir plus d'appui à tous ceux qui ont des préoccupations à partager, mais aussi des mesures pour mettre fin à cette culture qui permet ou qui tolère de l'intimidation, de l'harcèlement au sein de nos institutions au Canada.
Oui, bonjour, Laurence Martin de Radio-Canada. Vous parlez donc d'enquête indépendante. Est-ce que vous confirmez qu'il va y avoir un comité d'enquête indépendante pour justement ces allégations d'inconduite sexuelle dans l'armée? Et si oui, pourquoi ne pas l'avoir fait plus tôt? Parce que cette demande est sur la table depuis plusieurs années.
On est en train de voir dans beaucoup de nos institutions, que ce soit nos forces armées, que ce soit Service correctionnel Canada, récemment avec certains rapports, que ce soit au sein de la GRC, comme on a vu dans la commission Bastarache, des problèmes culturels, d'une tolérance d'abus ou d'harcèlement qui n'a pas sa place nulle part au Canada. Nous allons et nous sommes en train de
we
regarder
will
les
and we
différentes
are
mesures qu'on peut
examining
mettre en
various
place
measures we
et
can
pour s'assurer que
implement
d'abord il y ait
to
les appuis
ensure that, first of all,
réels
there is
pour tous ceux
true
et celles
and
qui
tangible
s'avancent
support
avec
to
des
those
plaintes,
who
des
come
histoires
forward with
d'harcèlement,
complaints
des allégations
and
sérieuses,
allegations of
mais
harassment.
aussi qu'on mette en place
But
les
also,
mesures pour changer la
we
culture
have to
dans
implement
nos
measures to
institutions,
change
pour
our
changer la culture
institutions'
dans nos
culture
lieux de travail à travers le pays.
throughout the
Nous
country.
avons fait des
And
avancées
throughout our
là-dessus,
workplaces, we
mais
have
nous
made
avons encore
progress,
plus à faire.
but
Nous
there
allons
is still work to
regarder
do.
évidemment
Of
tous les
course,
différents
we will
rapports et
examine all the
recommandations
various
qui ont
reports
été
and
faits et
recommendations
nous
that
allons
have
agir.
been made, and we will act.
I think what we're seeing over the past days, weeks, and months is a really troubling pattern in Canada. Whether we talk about the news coming out of the Canadian Armed Forces, whether we talk about the Bastarache report into the RCMP, or even recent reports coming out of Correctional Services Canada, we see that our institutions in Canada are not doing a very good job either of preventing a culture that tolerates harassment, intimidation, and even assault, or puts forward measures to support anyone who comes forward with stories of harassment, intimidation, or assault. This needs to end. There have been, as has been pointed out, numerous reports and recommendations made on measures that can be put forward to do that. We have taken steps as a government in that direction, but there is more to do, and we will do more.
Question de suivi, M. Trudeau, parce que vous l'avez dit, ça fait des années qu'il y a des allégations au sein des forces armées canadiennes. Cette demande pour un comité d'enquête indépendant, elle existe depuis des années, elle a été faite à votre gouvernement depuis des années. Pourquoi est-ce que vous n'avez pas agi? Parce que quand on regarde ça de l'extérieur, c'est un peu comme on se dit, bon, ben, on a attendu qu'il y ait un scandale pour agir.
Au contraire,
on a agi. On est allé de l'avant avec plus de mesures, plus de structures pour mieux répondre à des allégations qui viennent de l'avant pour transformer la culture avec Opération Honneur, par exemple. Mais ce qu'on est en train de voir, c'est que les changements qui ont été apportés n'ont pas été assez rapides. Il va falloir qu'on en fasse plus et on va en faire plus.
We will do more.
I think we have taken significant measures over the past number of years in Parliament with C-65 around our armed forces with a number of recommendations. We've moved on from the Deschamps report. We're moving forward on measures within the RCMP, and we've moved forward on measures within Corrections Canada. But what is obvious is that those measures didn't go far enough and they haven't moved fast enough. And that is my commitment, that we will be moving faster and going further to make sure that anyone who serves their country or works for the government or ideally works anywhere in Canada has a safe workplace and recourse if they are unsafe.
Prime Minister Lee Berthiaume, Canadian Press. Parties left and right of yours are calling for more targeted supports for sectors that will likely be last to emerge from the pandemic. Why are you resistant to this idea?
We have, from the very beginning, delivered on our promise to Canadians that we would be there to support people as long as it took, as much as it took. That's something that we've demonstrated. Of all the money invested in helping Canadians get through this pandemic, 8 or 9 of every $10 has come from the federal government. We have been there. And these supports have been targeted to the most hard-affected sectors. Airlines have received over $1.5 billion in supports. Tourism operators have received support through the wage subsidy, through the CEBA. There have been many, many different supports that have gone to the hardest affected sectors, and we've further extended those supports. We have announced supports in our fall economic statement, and we certainly hope that parties in the House, particularly the Conservative Party, will stop playing games, blocking and obstructing the passage of important legislation from medical assistance in dying to measures to support families. We know it's important that our democracy continues to function, that we continue to have robust debate around all these measures, but even the NDP and the Bloc are now pointing out that the Conservatives are being obstructionist in the functioning of Parliament. We need everyone to work together to be able to continue to deliver the supports for Canadians that they so richly need in this difficult time, even as we approach what is hopefully the end of this pandemic with the arrival of mass vaccinations.
Prime Minister Tom Perry from CBC. I know you don't want to get involved in a constitutional debate. I know you don't want to comment on the royal family. But I would like to ask you, how do you reconcile your support for the monarchy with your stated desire to dismantle the legacy of colonialism in this country?
There are many institutions that we have in this country, including that big building right across the street from us, Parliament, that has and is built around a system of colonialism, of discrimination, of systemic racism in all of our institutions. But the answer, Tom, is not to suddenly toss out all the institutions and start over. The answer is to look very carefully at those systems and listen to Canadians who face discrimination every single day and whenever they interact with those institutions, to understand the barriers, the inequities and inequalities that exist within our institutions that need to be addressed, that many of us don't see because we don't live them. That's what fighting systemic discrimination is all about. Listening, learning, and improving and transforming our institutions. We have been open to that. We have been working on that from the very beginning. Obviously, I wish all the members of the royal family the very best, but my focus, as we've said, is getting through this pandemic. If people want to later talk about constitutional change and shifting our system of government, that's fine, and they can have those conversations. But right now, I'm not having those conversations. I'm focused on getting us through this pandemic and bringing our economy roaring back. Je pense que c'est très important de comprendre.
I believe that it is very important to understand that we live in a system with institutions that were built not for everyone, but only for the few. And over the years, yesterday we recognized that it was not even 100 years ago that women were given the right to vote. We still have a lot of work to do to eliminate discrimination and systemic racism in our institutions. But that doesn't mean that we simply have to cast all of these institutions aside and then start from scratch. What we have to do is take a good look at our existing systems to remove existing barriers and inequities. The way to do that is to listen, to really actively listen those for whom this system is unjust, those who suffer from personal systemic discrimination, so that we can learn to do better. I wish the best to the royal family, but my priority right now is to transform Canada to be more fair, just and equitable. Just a better Canada for everyone.
Prime Minister Mackenzie Gray with CTV News. On vaccines, Johnson & Johnson has told the EU that they'll be under stress to meet their second quarter targets for vaccine supply. Has the company told you there'll be delays in Canada? And can you give us at least a ballpark date on when we can expect our first Johnson & Johnson shot in Canada?
First of all, we are very pleased to be one of the very first countries to authorize the Johnson & Johnson vaccine. With the approval of Janssen, we're now one of the only countries in the world with 4 major effective vaccines approved for use in Canada. We have heard in many conversations with Johnson & Johnson that there are challenges around production of the Janssen vaccine, but we will continue to engage with them. We look forward to receiving doses as soon as possible, and as soon as we get confirmation of doses being sent to Canada, we will let everyone know.
Thank you, and that concludes the time the Prime Minister has. The doctors and Minister LeBlanc will be available for questions in just a moment, and we'll start over on the phone once Prime Minister leaves. Operator, over to you.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous. Madame Lévesque, vous êtes peut-être en mode discrétion?
Oui, bonjour. Bonjour tout le monde.
Good afternoon,
Ma question,
everyone.
en fait, c'était peut-être le ministre Leblanc, je crois qu'il est sur l'appel. Je ne sais pas si M. Leblanc, je peux m'essayer avec vous au sujet de cette entrevue donnée au sujet de la famille royale. Je me demandais, vous, comment est-ce que vous avez réagi personnellement en sachant que la famille royale avait eu des discussions ou des préoccupations sur la couleur de la peau du petit Archie?
Moi, je pense que le Premier ministre a bien répondu à la question. Nous n'avons pas de commentaires à faire sur la situation de la famille royale. Nous demeurons comme gouvernement focusés sur la question de la pandémie, de la relance économique. Moi, personnellement, je n'ai pas vu les entrevues et je sais que le gouvernement n'a pas l'intention de commenter sur ces questions-là.
Un suivi, Catherine?
D'accord. Oui, très bien. Et puis, je me permets aussi de vous relancer sur un autre sujet, M. Leblanc, l'aide médicale à mourir. On tente juste de comprendre, en fait, s'il y aura, si le gouvernement va déposer une motion pour limiter le débat ou un bâillon, en fait, pour s'assurer de respecter le délai du 26 mars. Est-ce que vous pouvez nous offrir une réponse en ce sens?
In order to meet the 28th of March deadline.
Il y a quelques moments, et je sais que ça préoccupe beaucoup de Canadiens. Les conservateurs tentent de jouer des jeux procéduraux pour ne pas laisser la Chambre des communes se prononcer sur les amendements qui ont été adoptés au Sénat. C'est un processus parlementaire très important. Je sais que mon collègue, le ministre de la Justice, a fait beaucoup de travail avec les parlementaires et de la Chambre des communes, mais aussi avec le Sénat. Nous croyons que les Canadiens sont impatients de voir la Chambre des communes se prononcer, d'arrêter les procédures pour empêcher la Chambre des communes de rencontrer d'ailleurs des délais de la Cour supérieure du Québec qui ont été prolongés à plusieurs reprises. Alors nous croyons que le moment est venu pour que la Chambre se prononce, mais mon collègue, le leader parlementaire, aura des détails au moment important sur ces questions-là, mais nous croyons que les conservateurs, et ce n'est pas juste sur la question de l'aide médicale à mourir, c'est sur la question des appuis économiques aux Canadiens. Les Canadiens s'attendent que le Parlement puisse fonctionner et que le Parlement puisse adopter des mesures qui sont vraiment dans l'intérêt de la sécurité sociale et économique des Canadiens.
Merci. Prochaine question.
Thank you. Merci. Next question. Prochaine question. Marie Lastel, Le Devoir. À vous.
Oui, bonjour, M. Leblanc, pour continuer là-dessus. Je pense que la confusion vient du fait qu'il y a peut-être un problème de traduction là, au sein de votre gouvernement. En français, votre leader en Chambre dit qu'il faut avancer rapidement et qu'il est content de pouvoir compter sur l'appui du Bloc pour faire avancer ces faits sur l'aide médicale à mourir. Mais en anglais, il dit « We will move ahead without further delay ». Donc, pouvez-vous confirmer si vous allez déposer une motion d'allocation de temps? Et qu'est-ce que vous répondez aux gens qui disent que ce débat-là ne devrait pas être précipité parce que ça touche des questions sensibles? Votre propre gouvernement disait ça il y a pas très longtemps, qu'il était préférable d'y aller par consensus compte tenu de le côté sensible du sujet.
Nous reconnaissons le côté évidemment sensible du sujet. C'est une question littéralement de vie et mort pour les Canadiens. C'est pourquoi nous avons affaire à plusieurs reprises, par exemple, de prolonger le débat parlementaire. Et nous avons aussi devant nous la réalité d'une décision de la Cour au Québec qui fait en sorte qu'on ne peut pas se trouver avec un régime différent dans différentes régions du pays. Le Parlement a passé beaucoup de temps à discuter de ces questions-là, mais quant aux décisions procédurales, je préfère laisser ça pour mon collègue, le leader parlementaire, qui, comme vous savez très bien, est extrêmement habile dans ces questions-là. Et je pense que lui aura possiblement des choses à dire au cours des prochains jours.
Un suivi, oui.
Ouais, vous avez aussi dit en réponse un peu plus tôt que les Canadiens s'attendent à ce que le Parlement puisse fonctionner, que les conservateurs font de l'obstruction non seulement sur l'aide à mourir, mais sur l'adoption de certaines mesures d'aide économique ou en tout cas d'amendements aux mesures économiques. Le premier ministre suggère la même chose. Est-ce que vous pensez que c'est possible pour le Parlement de fonctionner encore comme c'est le cas en ce moment pendant un an, ou est-ce que vous êtes en train de télégraphier qu'il va falloir peut-être aller chercher un mandat plus fort?
Moi, je pense, Marie, nous avons été très clairs que les Canadiens ne cherchent pas et ne veulent pas une élection dans le contexte de la pandémie. Les Canadiens s'attendent que le Parlement et les parlementaires vont travailler ensemble. Et je pense que ça a été le succès depuis un an. Il faut constater que le Parlement, la Chambre des communes et le Sénat ont adopté énormément de mesures très, très importantes pour appuyer les Canadiens dans le contexte de la pandémie. Et c'est le travail que nous cherchons à continuer. Nous voulons travailler avec les partis d'opposition. Nous reconnaissons que c'est un Parlement minoritaire. Alors, il faut travailler avec des collègues à la Chambre des communes afin de trouver la meilleure façon d'appuyer les Canadiens dans le contexte économique, évidemment le contexte de santé publique aussi. Alors, c'est le travail sur lequel nous sommes focusés. On comprend aussi que les conservateurs ont depuis déjà plusieurs semaines démontré une volonté de retarder, de repousser les chances que la Chambre des communes puisse se prononcer. À un moment donné, la démocratie commence et finit avec des votes. Alors, à un moment donné, il faut laisser la Chambre des communes se prononcer. Et c'est un travail que nous cherchons continuellement à faire avec tous les partis d'opposition. Et comme j'ai dit, nous sommes très chanceux d'avoir M. Pablo Rodriguez dans ces fonctions-là dans le moment actuel parce que je pense qu'il va réussir à trouver les bonnes façons de collaborer avec nos collègues de l'opposition.
Thank you. Next question, operator.
Thank you. Merci. There are no further questions registered.
Excellent. Thank you. We'll turn to the room. David.
Thanks very much. This is a question for Dr. Tam. Of course, Dr. New, if you'd like to join in as well. It just comes back to the issue of the intervals between the two-dose vaccines. I'd like to get your thoughts on this. There's a letter circulating from researchers at the University of Health Network that says extending that interval is a bad idea, and that follows up on what Brad Wouters, I don't know if you know Brad, he's in charge of research at UHN, and he tweeted last week, there are no data. Nobody in the world has been 4 months between doses. These are RNA vaccines never used before. We should use evidence to make decisions. Canada is conducting a population-level experiment. Could I get Dr. Tam to comment on this debate in the scientific community and how should Canadians interpret this?
Yes, so I think you've seen the recommendations from the National Advisory Committee on Immunization on increasing that dose, extending that interval with the primary objective of providing a safe and effective first dose to as many people as fast as possible, and then coming back with that second dose is not a one dose strategy. And I think their recommendation comes in several steps, if you like, that we can sort of unpack a bit. First of all, is increasing evidence of the efficacy, the effectiveness in real time gathered from different countries as well as domestically of the effectiveness of that first dose. And the interval or the amount of data that was gathered really amounts to about 2 months and counting. Every day you get a bit more information on that interval. And at that point in time, the effectiveness is high. And so at the 2 month interval, when the effectiveness is high, it is not expected that that kind of protection will suddenly disappear overnight. And so the committee looked at, well, what would happen to that immune response based on existing knowledge about vaccines and immunology already in place. So if that level of immunity is not expected to suddenly drop, increasing the flexibility of the ability of the provinces to deliver that first dose, which is really safe and effective to as many people as possible to prevent deaths and hospitalizations is paramount at a point in time where, as I said, we're in a bit of a delicate situation when the epidemiology is that we still have thousands of cases a day, hospitalizations and deaths. This was felt to be the most important objectives. And on top of then the NACI recommendations, as you've seen, the chief medical officers and the provinces really embrace that approach. And lastly, is that, of course, the real-world data and the surveillance of vaccine effectiveness will continue to be gathered by experts such as those from the BC CDC, Dr. Danuta Skoronsky, Dr. Gaston Dessert from the INSPQ. We have the capacity in Canada to monitor that over time. Lastly, of course, as supplies increase, we suddenly got really great news on Friday of some additional forwarding of the Pfizer vaccines. Then that interval is not to say we have to give it at 4 months. It's just as fast as you can possibly give that second round. So that is a strategy, and that is a consensus position from all the chief medical officers.
Covering the advertising campaigns of politicians back and forth over policies. But given this debate, the uncertainty, we have Anthony Dale, the president of the Ontario Hospital Association, saying that, quote, to engender trust and confidence within the healthcare system and the general public, we need more from the Public Health Agency of Canada, the Health Canada, advertising and engaging in public relations beyond just maybe tweets, to tell Canadians about this interval issue and perhaps to, I don't want to say combat, but to present your case versus other researchers who have different views on this 4-month interval issue. Can you speak to how you can get your message or get a message out to Canadians to explain to them about this 4-month interval issue?
Yeah, so I think communication is always really important. And I do think we can do more in all facets of communication. So as you've seen that in the light of need to move rapidly in a public health context, as new information keeps coming in, there will be many different voices looking at the same data in different ways. But you're right, there needs to be more engagement and more communications. And that's not just public communications or doing press conferences. I think it is engaging communities all the way down. Health professional groups, we have been engaging different health professional organizations. We need to continue and do more of that. And also communities writ large. And I think that speaks to not just the question of the interval, but overall in terms of all the questions that I have about vaccine effectiveness and safety. And to that effect, I think some of the more innovative approaches has been this Vaccine Community Innovation Challenge that was just launched to award different community-based organizations into providing trusted information to their own communities, which is really important. So, of course, we need to translate the NACI recommendations, which, by the way, will keep evolving. That's the challenge, is how do we keep communicating evolving recommendations to the public and different communities in real time. So you will see some of those other innovative measures. But you're right, it's not just about public communications. Community engagement is really important, and we all need to do better at that.
Mackenzie Gray here from CTV. I've got 2 questions for either Dr. Tam or Dr. New. Yesterday, the CDC came out with recommendations for people who are fully vaccinated about new guidelines about what they'd be able to do. I'd like your opinion on 2 things they said to give guidance to Canadians who are fully vaccinated. One, they said people who are fully vaccinated can meet inside, no social distancing, no masks, with other people who are fully vaccinated. And in the same vein, they said that elderly people who are vaccinated could meet with their grandkids, give them a hug, spend some time together inside again, no social distancing, no masks. What would your guidance be for Canadians who are fully vaccinated?
Well, I think it's really important that we, again, adapt our measures when it is safe to do so, while considering as I've just said, the evolving scientific evidence, but also expert advice and balancing risks and benefits. And I think, what I will say is that together with the other chief medical officers, we'll be constantly assessing not just vaccine coverage, by the way, but the risk of transmission at the community level. We have considerable community level transmission at the moment, although things have improved. We don't know what the variants are about to do and whether we can keep control on their spread at the same moment as the vaccine coverage is just beginning. So I think we need to take a thoughtful approach, but it is important that we have to evolve our public health approach as more Canadians are getting vaccinated. So I think, our key message is keep your current personal protective measures for now. And then we will, together with other chief medical officers and our experts, provide evolving recommendations. I do think the CDC recommendations are quite sort of precautionary. They're just talking about, private settings and very specific kind of situations when people are fully vaccinated. And so we will also be looking at some of these kinds of adjustments when it is safe to do so. But as you've seen, jurisdictions are just beginning to ease some of the more sort of restrictive measures in the community. So they need to know what is going to happen next. Can they keep the transmission at bay while boosting their coverage? So I think we just need to be very thoughtful about how we do it, but we do need to evolve as time goes on.
You've talked a lot about once people are fully vaccinated, the risk of hospitalization is near zero and that no one has died who has been fully vaccinated from the trials. So when you are fully vaccinated, if you do end up catching COVID-19, how concerned should you be either for a family member, concerned about an elderly person who might get that, or for yourself once you're fully vaccinated?
So there's individual protection, which is really important. And I think we've basically seen the effectiveness of all the authorized vaccines in protecting against serious outcomes. What we do not know, and there's still limited evidence, but it is evolving, we'll get more, is how vaccines prevent transmission. So even the most effective vaccines are not 100%. And you don't know how well protected individuals are. So I think for the time being, as I said, it's important to keep up with these measures. But over time, we will have more information that shows what we can do in the context of people who are fully vaccinated. But I do think in Canada, the strategy is get as many people vaccinated as fast as possible. Because if you imagine you're a senior and you've been vaccinated, but outside of your home or your individual context, the pandemic is escalating, or if other people are not vaccinated, then the risk and benefit ratio has to be sort of looked at. So, but the key piece so that we are all in a better footing is to get truly as many Canadians vaccinated, as many people in Canada vaccinated. I'm not just talking about Canadians, anyone in Canada vaccinated as fast as possible has got to be really our focus.
Yes, this question is for Dr. Tam as well, Libre Theme, Canadian Press. I just wanted to follow up on what you were talking about there. One thing that you said was, this whether vaccines are preventing the spread of COVID-19. I'm just wondering if we've seen any evidence, any early evidence. You seem to say that information is still being collected. But if you have any early evidence of whether vaccinations are preventing or in any way curbing the spread of COVID-19 as well as preventing serious illnesses.
Yeah, so I do see the initial positive signs that vaccines, for example, some of the mRNA vaccines have been rolled out earlier on, but also some of the clinical trial data that will still keep coming out, is that there seems to be some effect on preventing infection for some of these vaccines. So there's early signals, but the data needs to continue to be analyzed. But, I do think that there's going to be some impact. To what extent that impact would be still remains to be seen. Right now, the goal is reducing severe outcomes, but we do have to look ahead now to, what will be the next steps in terms given as the data comes in. But there are some early signals that some of the vaccines will, partially at least, prevent transmission.
And I wanted to ask whether Canada has any evidence that the variants are spreading more rapidly in this country. What are we seeing in terms of trends with the variants?
Mm-hmm. Yes, I didn't give my usual sort of numbers update today, but we now have, I believe, over 2,000 identifications of the variants of concern in our positive cases, which means that the numbers are going up. There's definitely signs of community transmission, particularly of the B117 variant from the United Kingdom. In Ontario, for example, they've articulated that 30% of their positive identifications now are due to variants of concern. Lower in other areas of the country at the moment, but I think this is a very present risk for us. So what we have to do again is to ease things really slowly and then, make sure that testing and sequencing capacity is there. As we slowly move towards spring and getting vaccines up and running, what I would say is that the capacity for screening for variants has greatly increased in Canada to the extent that the majority of provinces, vast majority, are screening or about to get the capacity to screen 100% for very specific mutations. And then sequencing has also improved greatly. And so, that's a good foundation. But we'll just have to watch really carefully as to what happens in the next couple of weeks, because many provinces have just began easing. And we will know, pretty soon, I think, as to whether we are able to keep the variants at manageable proportions while vaccines are escalated, which is why now is not the time to sort of make too many shifts in the public health measures at this time, but we will be able to do so based on what actually happens next.
Hi, it's Tom Perry from CBC. Vaccine hesitancy has been kind of an issue we've been talking about for a while. I'm wondering, as the vaccines are rolling out across Canada, how much of that you're seeing, how many people you're seeing who are just refusing to take these vaccines. And I'm wondering if, when you're setting up your modeling, if there's a number that you sort of look at, an estimate for how many Canadians will just under no circumstances agree to be vaccinated.
Yes, so of course there is many different sources of information in terms of vaccine uptake. So first of all, people do surveys, sort of public opinion research. And what we're seeing is that more and more people in Canada are saying they want to get the vaccine. So I think partly it's because we've seen some pretty great results domestically and internationally, and that we have detected no safety signals of concern. So we've now given vaccines to quite, people would say not that many, but quite a few, we're now into the millions of people getting vaccinated, and the long-term care outbreaks have reduced. The seniors, particularly those over 80 that have been the prioritized group, we see their rates dropping and crossing, all the other age groups in terms of how well they're doing with both case counts and serious outcomes. And so with that in mind, I do think that there's an actual increase in the number of people who want to get vaccinated right away. There are some who still want to wait a bit, and there's questions. We have to be able to answer those questions. But that's the trend that we're seeing, which is great. Secondly, is that there's been a very high uptake in certain settings like the long-term care facility residents, and in many cases over 90%. In the territories, you will see a high uptake, and they're moving ahead really fast as well. And so, with that in mind, I think that's a positive trend. We still, of course, need to continue to address the remaining questions that people have all the time. And we just talked about the challenges of communicating, evolving information as we go along, as we gather more information. So that is always, one aspect that we have to make sure we do well in order to maintain that public confidence. And the other aspects, which is getting community leaders, getting individuals who are trusted within those communities, continue to support the vaccine programs. We actually have seen quite a number of the leaders in Indigenous communities, in other communities, religious leaders. They're all actually beginning to support some of this, and we've been giving them the information and tools that they needed. And so I think to me, we're definitely in a more positive trend from a vaccine confidence perspective.
And I just had a question for Minister LeBlanc, if he's still there.
Sure, go ahead, Don.
Oh, hi, Minister. I'm just wondering if you can give us an update, if there's any progress in terms of establishing a process for choosing a new Governor General, where that stands at this point.
Sure. So as I had said and had hoped that we would have something to say in terms of a potential process to recommend the next Governor General a couple of weeks ago. I think we're getting closer. The one element that remained to be finalized, I understand, is concluding. So I hope very soon we're in a position to talk about a potential process. I think it's also important to note that the Chief Justice has been acting as the administrator because the office of Governor General is vacant. So we feel some obligation for the process to generate the appropriate recommendation in an expeditious time. But we'll have more to say on that, I hope, literally in the coming days. I understand that I'd said that 10 days ago, but I think it's imminent.
Can you offer any detail about that last sort of piece of the puzzle you're talking about?
No. As I say, we'll have good. It's a nice try, but no, we'll have something to say. I hope soon. But we recognize the importance of proceeding expeditiously because it's an unusual circumstance to have Chief Justice Wagner acting as the administrator. So we're conscious of that responsibility.
Thank you, Minister LeBlanc. Thank you, doctors. That concludes today's press conference.
Thank you.
Thank you. The conference has now ended. Please disconnect your lines at this time. And we thank you for your participation. Merci. La conférence est maintenant terminée. S'il vous plaît, raccrochez vos lignes. Et merci à tous les participants qui ont joint.